Good morning. This is Senator Thom Tillis calling from my North Carolina home. I am actually hosting now the 9th teletown hall for the state. We've reached out to thousands of people to try and give you the latest information, but more importantly, answer your specific questions. So if you're on the line already, we'll have people joining us over the course of the next 45 minutes or so. If you press *3 on your touch-tone phone, you'll be connected to one of my staff who are either here in the state or up in D.C. You can give them an idea of the nature of your question, and then you'll be able to ask your question live. I do ask that all questions focus on the COVID virus, the economic stabilization measures, basically what we're doing to beat the virus and to help people in North Carolina recover and sustain some of the economic damage that's been caused by the quarantines and various other actions that we've had to take in the interest of public health. By way of update, there are over 800,000 confirmed COVID cases globally, 39,000 deaths. In the United States, we have almost 165,000 cases confirmed, 25,000 new cases over the last 2 days, and we have had almost 3,200 deaths. In North Carolina, we have 1,400, almost 1,500 cases. The seventh day of triple-digit increases. We've had 157 hospitalizations and 8 deaths. One thing that I would caution you on, as we see the number of cases, doesn't necessarily mean that the virus is spreading more rapidly. Our ability to test is ramping up rapidly, and we're reporting more information so that we can better track the disease, and we can also track where we need to put our resources, particularly for the minor percentage of the population, or I should say the minority percentage of the population who will have serious complications. What we're seeing in other countries, what we're seeing across the nation and in North Carolina is that the at-risk population are older persons and generally older persons with other underlying health conditions. But anyone with a serious underlying health condition, particularly respiratory conditions, heart, complications with diabetes, they seem to be the most vulnerable for this virus. Most people will experience flu-like symptoms, a high fever, maybe some difficulty breathing and a dry cough, and there also happen to be symptoms of the flu, and for some people even symptoms related now that we're at the peak of the pollen season here. So if you feel like you're ill, do not go directly to the doctor. Call your doctor, call an urgent care facility, or call your local health department and get their advice on how best to act next. In some cases, they may instruct you to do a test. There's an increasing number of healthcare facilities that are allowing drive-through tests. You can come in, take the swab, not even get out of your car. That gives you protection against getting the illness if, in fact, you don't have it. It also provides a healthier or safer environment for the healthcare professional to administer the test. Again, if you've just joined the call, if you press *3 on your touch-tone phone, then you can ask your question live here in a minute. In addition, I'm sure I'll get questions about the health implications. One thing that we need to do if we want to flatten the curve, and what that means is try to spread out the length of time that anyone gets the virus and hopefully reduce the number of people who have to go to a hospital or have a more serious treatment provided. The best way you can do that is follow the guidance of your local, state, and federal experts. Social distancing is working, and the more people do it, the fewer instances of the virus we're going to have. Stay at home if you don't need to get out, and make sure that you heed all of the stay-at-home and restrictions that local agencies are putting out there. They're doing it based on the data. What we want to avoid is what's happened up in New York and other populous areas. They tend to be the most at risk because there are more people, more interactions. We need to do our part, every one of us, to try and prevent the spread. We're going to go to a question here shortly, but if you want to ask one live, we have this streaming online, so we have questions submitted online. I'll go to one of those in just a moment. But on the economic stabilization package, this is the third bill that we've passed in response to the COVID-19. The first bill was just to basically get resources to federal, state, and local agencies for the healthcare systems. The second bill was to provide the American people and people in North Carolina with a very clear message that we were going to help those who were displaced from their jobs because of closings, illnesses, the school closings, creating child care challenges. So we passed that bill, which was called Phase 2. Phase 3 was the largest economic stabilization package that's ever been passed in the history of the United States. It's about $2 trillion in total. A good portion of it will go to economic assistance for individuals. If you are a single person, you would get a $1,200 one-time check, not subject to federal income tax or state income tax. If you're a couple, it would be $2,400, and if you have children, $500 per child. That has limits on it on the high end of income earners. If at $75,000, your payment will decrease somewhat up to $100,000. For a household, that's $150,000, so two adults. The checks should start going out over the next 2 or 3 weeks. They'll be sent from the federal government through the IRS. If you filed a tax form in 2018, 2019, the IRS has your contact information. It will be sent to you. If you've opted for electronic deposit, it will not be a check. It will be an electronic deposit. If you haven't filed taxes in 2018, 2019, you can go on the IRS website and file one for 2020 that would then put you on the map for the IRS to provide assistance based on your tax filing. It's a quick form. If you go online, I believe you'll find it at the landing page for the IRS. The last thing I will tell you is we're making great strides in testing. We've completed in North Carolina almost 20,000 tests and several thousand more being processed. Nationwide, over 1 million tests, which is one of the reasons why you're seeing the numbers of cases go up, as I said earlier. At the end of the day, though, the curve, we're still on what they would consider to be the left side of the curve. We're going to see additional cases, probably substantially more over the next couple of weeks as we ramp up testing, because testing is becoming quicker. We now have Abbott Labs that has had FDA approval for a test that takes less than 30 minutes to administer in the office. That's the good news. However, there's certain equipment that's required to process those tests, so it will scale up as we scale up the other test mechanisms as well. Again, if you joined the call, this is Senator Thom Tillis from North Carolina. I'm reaching out to North Carolina citizens and trying to get to a point where we can answer as many questions, and we won't be able to answer them all, but if you go to tillis.senate.gov, you'll be able to get information there. You can contact my office. My Washington and North Carolina office numbers are on that website, and we're happy to do anything we can to help you. Again, if you press *3 on your touch-tone phone, you can ask a question live. While we're waiting to queue up those questions, we have a question online from Danielle, and Danielle asked, will the public be required to wear a mask, and will they be provided to the public? Right now, Danielle, the priority is to get the mask in the hands of people that we're asking to go to work, to healthcare workers, to first responders, and to those who are out on the front lines, grocery stores. So at some point, I think that we would see masks provided to the public, but now, in the meantime, I would just encourage you to not get into a situation where you need them. Stay out. Do not go out if you don't need to. Do not even expose yourself to family members that you're not living with right now, so that would be the best defense. And a mask is not a guarantee that you don't get it or that you don't spread it if you have it. So the key thing here is to just wash hands, use hand sanitizer, stay at home if you can, stay away from groups, and contact your loved ones through phone conversations, through video conferencing, whatever other tools you may have. But short of that, I would suggest just social distancing and listening to the epidemiologists and the clinicians in terms of how you can prevent the spread and avoid getting infected. Again, if you press *3 on your touch-tone phone, you can ask a question online. One thing I will tell you that I should have mentioned in the opening comments, the good news is we had a lot of people who were able to go out and get supplies, groceries, and the things they needed to support their family. The bad news is that caused shortages in some grocery stores. There are a lot of people out there who are just simply not able to go and stock up on a month or two supply. So if you know of people that may be in that category, if you know of a senior citizen or someone with underlying health conditions that would make it dangerous for them to get out, give them a call and try to offer some support. Try to find a way to safely provide supplies to them. We had a teletown hall earlier this week. A 72-year-old lady with a number of underlying health conditions, doesn't have family near her, and needs to get prescription drugs and groceries. We're really suggesting you think about people in your community and try to reach out to them if you can. Do it in a safe manner, observing social distancing, but please do it in a way that actually takes care of the rest of your community. Our next question, if you want to ask a question live, press *3 on your phone. Next question has been submitted online, and it's from Caroline. Caroline asks, can you get COVID again after having it? Caroline, we believe that you can, at least in some of the preliminary results. People have tested positive after they have had the illness. What I've seen, I don't know if this is across the board, but what I've seen in the reports is that I'm sorry. I had you, Caroline, if you're on, why don't you ask your question?
Hi. My daughter has had the coronavirus once, and I just want to know if she is able to be reinfected. Is my first question.
We do believe that there is evidence that some people who have had the virus, tested positive, went through the period not exhibiting symptoms, test positive again. There is a possibility. I haven't seen the data, Caroline, on whether or not they've just tested for the virus and they're asymptomatic. I know many people are. So in other words, they appear to have the virus, but they have no signs of it, which is why we need to make sure that people who get the virus, who think that now they're immune to it, that they not go out in the public. They may not have the symptoms again, but they could potentially infect someone else. Okay.
Well, she is in quarantine. My next question, Mr. Tillis, is, we're in Iredell County, and I want to know, my husband is an essential worker, and how can he get the protective gear that everybody's talking about as far as the masks and everything, not necessarily the gloves, but at least the masks? And what status are we in now for Iredell County? I mean, are we locked down, or what is the status of that?
Well, I don't believe that Iredell, I'm in Mecklenburg County, I don't believe that Iredell has issued any stay-at-home orders yet, but with highly populated areas like Mooresville, it could happen based on any increase in reported incidences. Right now, Davidson has no reported cases. Most other towns in Mecklenburg County have it. Now, with respect to your first question about the mask, I would suggest that the first thing that he do, if he's in an essential category for a job, that you call the Iredell Health Department, explain your situation, and then let them see whether or not he's in a setting where he community should get it, and they've got to balance that with the hospitals, medical centers, and other essential personnel. But the best thing now, because what the federal government is trying to do is work with the state agencies. We're concerned if we send resources and bypass all other agencies, we may miss some areas that are in greatest needs and oversupply areas that are not as at risk right now. So going to the Iredell Health Department, contacting the Iredell Health Department and getting their advice on how he can get a mask would be the best advice that I could give you at this point. And certainly I thank your husband for going to work, and I thank everybody else who's out there, not only the healthcare workers, my daughter who's a nurse down in Charlotte, but first responders, police, fire, medics, people working at the grocery stores, people working at restaurants and food facilities are all a very, very important part of us being able to keep moving as we combat the virus. So, Caroline, thank you for your question. If you all want to ask a question, if you press *3 on your touch-tone phone, you can ask a question live just like Caroline did. The next question is from Sarah. Sarah, you should be online. Sarah?
Yes.
You can ask your question.
My question was, is there any way that we can spread COVID-19 through takeout or delivery containers?
The Dr. Fauci, Dr. Birx, and others believe that it's a very unlikely way to actually become infected. It has more to do with direct human contact or mainly through direct human contact. However, you should be very careful in the way you handle it. You should gel just after taking food or transferring it, but you would do that in any case. If you go to the grocery store, make sure that you've got sanitizer to clean off the shopping carts and the baskets, and just limit contact. But anytime you make contact, say out of the home, if you're staying at home, then it should always be preceded by and followed by hand washing, and it's not just a quick 2 or 3 second sprinkle on the hands. About 20 seconds of hand washing with soap is very, very important. But again, right now, although it was reported that the virus can live for a limited period of time on an inanimate object, that most of the data that the epidemiologists are sharing with us suggests that it's more through direct contact. So I think that you can be reasonably safe to go and get food in a takeout container, maybe transfer it to a plate, gel before you eat, and I think it would be minimal risk. I think the next question is, you should be live. Is this Mr. or Miss Davis? I think, do we have a question? The screener said they were not able to get the person's first name. We have Mr. or Miss Davis.
This is Larry Davis.
Oh, okay. I'm sorry, Mr. Davis. You can ask your question.
Yes, my wife and I receive Social Security, and I have a small part-time job. I was just curious if we would be receiving a check.
Yes, sir, you will. And if you're able to get online, if you go to my website at tillis.senate.gov, it will give you an idea, depending upon your income and other factors, it would give you a rough idea of the amount of the check. But you, along with a number of other people, independent contractors, people who are typically not qualified for unemployment, are going to get the economic, or I should say the checks that we've been talking about. I talked about earlier on the call, the $1,200 checks, and they could also be eligible for supplemental unemployment, which you typically would not get as a independent contractor, but may be qualified under the Phase 3 bill that we passed last week. But anyone who has questions on that, you can go to tillis.senate.gov. We're putting a summary out. We're updating it every day when we pass a bill, that really provides the administration with authority. Then they have to write rules and set certain parameters right now.
Thank you, Senator.
Next. Yes, sir. Stay healthy. Yeah, again, if you've just gotten on the call, this is Senator Thom Tillis from North Carolina. If you press *3 on your touch-tone phone, we'll be answering questions here for about another 30 minutes. The next question is from Richard, who's listening online. And he asked the question, how long will it be before we flatten the curve? To be honest with you, Richard, a lot of that is going to depend on how the population reacts. If we have a good number of the population at all ages stay at home if they can, stay away from family members if you live separately, do not get into any size groups, honestly. Groups of 10 or more is what the administration is recommending. Groups of 50 or more are prohibited in the state under the governor's executive order. But if we really want to flatten this curve, it's going to depend on the population heeding the advice of their state, local, and federal officials. We have various estimates of 4 to 6 weeks. It could be in certain areas much lower than that based on how well the population responds to the distancing orders, washing hands, sanitizing. And I think that what the president is hoping for and what he's messaging is that we'll see the peak somewhere in late April or early May in our area. It may be sooner in other areas that were hit earlier. And then hopefully we're getting back to some path to a normalcy in the May-June time frame. That's the best information we have right now, but I'll be honest with you. The government can only do so much, and what the government's really asking everyone to do is to stay at home if you can, wash your hands, and do not get in unfamiliar situations with people. That's the best way for us to combat this disease. I'm honoring that request, which is why I'm doing these teletown halls and trying to minimize the impact that I could have on potentially infecting someone or infecting myself and my family. So, Richard, thanks for asking the question. Next question is from Daniel. And Daniel, I think you have a question on social distancing.
Yes, Senator. Thank you for the town hall and the invite. My question is, if everybody adheres to the stay-at-home policy, of course, some people are going to have to get out for essentials. Has anybody in the government thought about limiting the number of people inside the essential businesses, so to help kind of detour some of the, interaction and contact that may, lead to spreading this? Just kind of limit the number of people in the grocery stores at one time. That's all I have.
Yeah. Well, Daniel, I'll tell you, I think that we're doing a little bit better in the grocery stores. I was in Washington until I returned home on Friday, and the grocery stores there, because there was a run on the grocery stores, they actually have implemented a policy where it's like one in, one out. So you wait in line at a reasonable distance outside. They're greeting people at the door, giving them hand sanitizer, allowing them to go in, and until someone else comes out. That's how they're trying to limit things. If you go to most grocery stores now, they put X's on the floors to give you an idea of how far apart you should stay. And I think if we see more evidence of people rushing the grocery store and just filling up shopping carts full of groceries, then they will have to implement that. Right now, it's any business could implement those policies, and they should if they happen to be in an area where they're seeing just an influx of people. That's dangerous on several levels. It's dangerous because they're getting close to one another. They can spread the disease. It's also dangerous because they may be buying more than they need at the expense of somebody else who's going to show up at the store and not have anything to purchase. So I think it's I think you're seeing that's why I'm guardedly optimistic that if we just continue to see it's sort of inverse, right? The more the population adheres to social distancing and businesses do, the flatter the curve's going to get. That's why these calls were so important. And hopefully after you all get off the call, if you'll contact a few people and just encourage them to stay up to 6 feet apart, do not and to stay away from unfamiliar settings and stay away from groups. But I think you're seeing an increasing number of businesses do exactly what you're suggesting and what I was describing. Also, just when you go into the store, be reasonable with the quantities that you purchase. Think about the next person in line who may not be able to get anything, and you may have 2 or 3 of them. Those are things that if we see further evidence that people are building up stockpiles, then the grocery stores are most likely also going to limit the number of individual items that you can purchase just to make sure that we get the broader community supported. The next question is from Stavro. I hope I pronounced that right. And you should be online. You can answer or ask your question.
Thank you for the town hall today and for the Q&A. My question is, at what point are we going to deem ourselves safe? Our situation's a little bit different. We have a terminal father-in-law. My wife's dad is terminal, going through his 2nd round of chemo, and he's not going to make it through it. So we want to have some family interaction with his grandchildren. We've been very adamant about the social distancing, the disinfecting, the hand washing for the last 15 days. And we're curious as to at what point are we safe to interact with him so we do not spread the virus to him. I'm very confident none of us have it at this point.
I tell you, I know that's a very difficult personal circumstance for you and your wife and your family. Rather than give you general advice, number one, you know that anytime someone, if they've already got underlying health conditions and they're receiving chemotherapy, which reduces your immune response, they are probably at the apex of the high-risk category. So I think rather than give you, again, specific advice for you and your family, I'm sure that you're in contact with the medical facility or the doctor who's providing care, and I would suggest you call them up. It is you have to think both in terms of the risk of exposing him, but also the risk of your exposure by going into a medical facility. So I'd urge you to speak with your doctor or the medical facility that they're in to see what they could do as the best alternative for you. I know that it's a very, very difficult time, but I will tell you that my mother, I've got an 87-year-old mother. She's in good health. She lives independently, and we've really limited the interaction with her to one family member who is making sure that her needs are provided for in terms of food or any kind of medicine that she may need. And I would say that in Stavro's case, or in your case, you've got a terminal condition and a lot of layers of complexity that add on to that. Anyone else who has a family member, senior, or anyone with underlying health conditions, please just call them on the phone, use on the internet, video communications, but do not expose them and do not expose yourselves. But in your case, Stavro, I'd suggest that you contact your doctor or or the medical facility and get their best advice. But please don't make a decision on your own. Go to the experts and please heed their advice, no matter how difficult it may be. Again, if you join the call, if you press *3 on your touchtone phone, you can ask a question. Next question, I think, is from William. William, you should be online.
Hello, Senator. How are you this afternoon?
I'm okay under the circumstances.
Well, I appreciate you doing this town hall, and I think that I have a good question. I'm 28 years old, and I think I speak for many people in my age group when I say that the news has portrayed millennials to be low risk. So many people in my group have not listened to the concerns seriously. And it concerns me because the people that are at risk, from my understanding, can still receive it from us, even though we may not display symptoms. Do you know this to be true, or is that what you guys, because the last few days, it seems like more information is being put out that might refute that.
William, it's absolutely true that you could have the virus and not have any symptoms whatsoever and potentially infect someone else. Something else for the younger group that I thought about after my teletown hall yesterday is that because it has not been fatal in the majority of cases among younger people without underlying health conditions, it doesn't mean that their actions are not going to produce a fatal event for someone else. They need to understand this isn't about them. This is about the community as a whole and people who are at risk. But there's another piece to this. Younger people have a tendency to go to the doctor less often. So how does that young person necessarily know whether or not they have an underlying health condition that puts them in a high-risk category? Everyone should behave as if they're in a high-risk category, either because they may be or because they may expose someone else who is. We are seeing a significant spread. I think it's beginning to taper down. You saw the much publicized spring break down in Florida. But these young people need to know they don't know if they have an underlying health condition. Asthma, other respiratory problems could potentially be a complicating factor that could lead to pneumonia or complications. So I think for two reasons, they need to look at this rationally and say, am I absolutely certain that I do not have an underlying health condition that if I get the virus is going to put me in a critical condition? And am I absolutely certain if I don't heed the social distancing warnings that I'm not going to expose someone who may ultimately die as a result of that exposure? This is a serious discussion that we have to have. It's not alarmist. What it is it's every effort that we can do as elected officials to communicate the seriousness of this disease and the reality that the actions of individuals are going to ultimately flatten the curve and beat this virus. And thank you for the question, William. I'm glad you're looking at it in a reasonable way. I'm more than twice your age, so I'm glad that gives me some faith in younger people to get that message out. Next question is from Sarah. Sarah, I believe you're online. You have a question on mental health?
Yes, I do. You know, President Trump said early in his briefings that what he didn't want is for the solution to be worse than the problem. And I am disappointed in the fact that he has extended this nationwide lockdown all the way through the month of April, because you cannot keep people locked away, not from each other, not from their jobs. Families, people are suffering because of this lockdown. One county, it was reported in Kentucky, has had 9 suicides. The National Suicide Hotline is inundated with calls. People are losing their livelihoods, and I understand that you did this, whatever, save your program, that you're just going to be throwing out checks to people. That is not going to fix the situation that people are in right now. People who have lost their jobs, unemployment is not going to recover everything that they have lost. People like my husband, whose pay has been slashed, yet he's still required to work the same amount, 40 hours, but they've slashed his pay because his company has already laid off 140 people, and they're trying to not have to lay off anymore. So your one-time check to my family isn't going to help us recover from what we are suffering right now. We still have bills to pay. We have a mortgage to pay. I just find this extended lockdown to be outrageous. That's not downplaying the severity of this illness. It's a virus. I get it. I understand. But I think that You people are supposed to be smarter than the rest of us. You are the people that we elect to be in charge and make the tough decisions, make the good decisions for the good of the country. We can still protect the vulnerable. There has to be a different way other than preventing people from taking care of their families. I just find this to be outrageous.
Sarah, you're in my position. What would you suggest we do?
I think there is still a way that you can allow people to go back to work. Sweden is doing it. Have you guys even looked at what Sweden is doing? They're not locking people away, and yet each country around them has taken the extreme measures like we have taken, but Sweden's like, no, we're not going to do that, because when you lock people away, when you eliminate everything, I mean, you have shut down our playgrounds for the kids. They've already had school taken away from them. Now they can't even go to the park to play, and now you are closing the walkways because too many people are using them. Do you know why so many people are using them? Because people cannot be locked away.
Well, first off, I would caution you to take a look at Sweden's case. They've had a high spike in deaths. Secondly, I live in Mecklenburg County. They have a mandatory stay-at-home order. They have allowed people to go to greenways, parks. If you go to a park, they're just simply saying practice social distancing. So I'm not sure exactly where you live. It sounds like maybe they've done a lockdown that I'm not familiar with. But now let's go up to New York, where they've got an Italy-like spike in coronavirus, and they had a mayor who early on was saying go to work and don't stay home. I think they're regretting that now, and you see a hospital ship over there with 1,000 more beds to try and take care of people who do not have coronavirus because of the huge spike. This is not a science. The science is trying to then allow us to exercise the art of making decisions based on outbreaks. I, for one, think that a nationwide shutdown is not a good idea. That's why the president has not done it. But I do believe that governors, like Governor Cooper here in the state, and mayors have to make a decision based on data where they're showing spikes. And this is, I've tried to use the analogy of hurricanes. In North Carolina, we experience a lot of hurricanes, and when we get ready for it, we see a storm track. We make a decision based on the best available information. The storm track changes, then we've got to move things around to get where the greatest need is. There is not a one-size-fits-all policy that's going to fix this for the country. People can get out. Essential travel for taking care of family members is allowed. And being able to get out and walk in a park or walk down at least in Mecklenburg County, which has one of the most stringent orders that I know of in the state, I've specifically read their frequently asked questions, and they say you can get out, you can exercise outdoors, practice social distancing. There's some scientific data that says that being outdoors, exposure to sunlight is good for you. So in your particular case, if you want to communicate with my office, tillis.senate.gov, I'd like to know exactly where you live and exactly what orders they put in place that are causing the restrictions that you're having to live with. It's not my understanding that that's common or even in place in any county in North Carolina, but if it is, I'd like to know about it. Next question. I think right now we have from Darlene, and Darlene's posting a question online, but just back to Sarah for a minute. Sarah, the thing that we can't do is if we send everybody back to work, I will guarantee you the peak will be greater. The number of hospital beds available for people who are chronically sick will be fewer, and a lot more people will die. We've already had 3,200 deaths in the United States. We will have many more. What we're trying to do is minimize that, flatten the curve, and then get back to work. I, for one, have really encouraged that we look at businesses that can practice safe work environments and create an ability for businesses to reopen if they think that they can do it safely. But I don't think there's any one policy nationally that's going to work, which is why the president is leaving a lot of this up to the state and local governments. I think the next question is from Darlene. And Darlene is she submitted this question online. Will you have to pay back stimulus checks? The answer is no. If you're getting one of these checks, and to Sarah's point, it's by no means going to make everyone whole. What it's trying to do is provide some assistance in this 4 to 8 week period where we think that people are losing their jobs, disruptions in payments, rent's coming due. You got to buy groceries, you got to buy medicine, but you do not have to pay it back. In fact, in some cases with businesses, if businesses apply for a loan, which was authorized with the Phase 3 bill we passed last week, if that business is using the loan to make payroll, that will be forgiven. That will not have to be paid back either. If the business used the loan for some other purpose, it will be required to be paid back. It will be a low-interest loan, and the terms be negotiated with your local banker or a Small Business Administration authorized banker. The next question is from Billy. And Billy, I think you also have a question about unemployment benefits.
Yes, sir, Senator. Thank you for taking my call. It kind of goes along. I missed a lot of this in the beginning. Just trying to find out about the stimulus program as far as the unemployment benefits. My husband, for instance, he lost his job last week due to the COVID virus. And when we checked and he applied for the benefit online, it was quite a bit less than what he makes on a normal basis. So with this stimulus, is that going to bump up the unemployment checks to where it's closer to what he would be normally making, so that we will be able to continue to make our bills until he's able to go back to work? This is hopefully just a temporary layoff, hopefully no later than May or June at this point in time.
Yeah, Billy, one thing that the Phase 3 bill that we passed last week has a provision in is an additional $600 a week from the federal government added to the state benefit. So that will be made operational over the next couple of weeks. So that will be a supplemental $600 a week check in addition to whatever your husband is qualified to receive under the state unemployment insurance. So that would be $2,400 a month in addition to whatever benefits you'll be receiving from the state of North Carolina.
Would that kind of go in at the same time, for instance, say, like, I think he's about 2 weeks before he receives the first check, so you're saying that would basically be paid at the same time, or is that going to be paid, like, separately from that benefit then?
It will actually come from the federal government, so I believe, unless it may vary from state to state, but I believe that you'll be receiving 2 different checks. But I do believe that the time frame right now, the Treasury and the IRS is working hard to try and get these payments online and out the door over the next couple of weeks. So, Billy, thank you for your question. Next question is from Mary Ann. And Mary Ann, I think you have a question about food prices or grocery store prices going up.
Yes. Social Security is the only income that I have, as a lot of people do. And the shortage of food has driven the prices up tremendously. Is there going to be any relief for the Social Security people at all?
Well, there's probably 2 pieces to this. I haven't seen any reports, but I'll make sure my staff let me know in terms of any systematic increases in prices. If you're on Social Security, you will be entitled to some additional supplemental income that was authorized under the bill that we passed last week. But it does speak to something else. We have seen some incidences or reports, I should say, that we're trying to get the facts behind on price gouging. I've filed a bill at the federal level to go after arbitrary increases in pricing. Most states have anti-gouging laws when there are nationally declared or state-declared emergencies. So we've sent a very clear message to anyone out there that are raising their prices just because they can. There's going to be a significant consequence for it. in some cases, prices may be raised just because of the demand. But in your particular case, if I think that between, and my mother, 87 years old, primary source of income is also Social Security. That's why we had a treatment in the bill to provide some supplemental assistance with the Phase 3 bill. And the amount of the benefit, those sort of details, if you're able to get online, if you go to tillis.senate.gov, you can get probably answers to most of your questions. If you don't, you can also post a question there and we can get back with you in your specific case. Well, you all, we're coming up on 45 minutes. We're trying to keep these, we're doing several of these calls. As I said, this is our 9th call. We're trying to reach out to as many people as possible. One thing I would just encourage you again, contact your neighbors, make sure that they're okay. If you know people with high-risk conditions, check in on them. Try to find a safe way to supply their needs. Minimize your contact with family members and unfamiliar settings. Give people a call in place of going and visiting with them. I think if we work hard on this in North Carolina, we can be one of the states that gets the curve flat as quickly as possible. And over the next couple of weeks, you'll see reports on my website at tillis.senate.gov. As soon as we hear when they start mobilizing and sending out the checks, we'll be updating. And in the meantime, if you all need any help, one thing I should have said when Sarah asked the question is we are concerned with the consequence of isolation, particularly when you have isolation compounded by the fear and uncertainty that many people are experiencing right now. The risk of suicide is high. And we've seen several reports of crisis lines. The numbers are going up 5- and 10-fold. So if you know someone who experiences anxiety or depression or have other mental health challenges, make sure you reach out to them, and if they need help, make sure that they reach out to crisis lines and other resources. If you're a veteran, contact the VA crisis line. If you know of veterans who may be in high stress right now, make sure that they're reaching out and contacting the Veterans Administration crisis line. But thank you all for being on the call. I hope the very best for you and the health of your family members, and please do your part to try and prevent the spread. Thank you all. God bless. Have a good day.